Dr. Denis, we have a few questions for you about braces. What is the difference between clear braces and fast braces?
What's the difference between fast braces and clear braces? Now, the difference really, I like to say, is lifestyle. If you can imagine, clear braces, Invisalign, ClearCorrect, is a clear set of aligners or trays that are completely removable by you. That means that we make molds of your mouth and we send them off to the company, and they create a series of aligners that will gradually either straighten your teeth, correct any bite that's out of whack, reduce your overbite, close your gaps with a series of trays that we give you every 6 weeks. So those are completely removable. You take them off, have a meal, and then you can put them back on after you brush. Now, fast braces is a lot different. Fast braces are more like traditional braces in that you have bonded brackets and wires to your teeth. Now, the brackets are a little different because the brackets are triangular instead of square, which allows us to move the root of the tooth as well as the crown of the tooth at the same time to make that process a lot faster, hence the word fast braces. So those are the main difference. I say lifestyle because some people are really not interested in having brackets or wires placed on their teeth, even if it is faster. And for the most part, most of my patients are adults that do fast braces, or teens even, and some people have relapse cases. That means that they had braces before and now they're getting braces again, and they're not really interested in having brackets or wires, even if it means faster. So they think a clear choice is Invisalign, and it may take a little bit more time, and most of my patients are still under 2 years. It may take a little bit more time, but at the same time they don't have to have something on their mouth and they can take it off and put it back on. So it's lifestyle. Some of my patients are not interested in having clear braces because they're afraid they're going to lose them. They say, listen, I'm not responsible enough to do that, so I'm going to lose it, I'm going to throw it away, so I'd rather have something I don't have to think about, which I put in my mouth. So that's why I said mainly it's lifestyle. Now, as far as clinically what it can fix, really that's something we have to determine together. So once I can take a look at your teeth, I will either direct you into the area that I think is going to best suit your mouth, or you can tell me what your needs are and say, look, Dr. Denis, I don't know how long it takes. This is what I want, and we will talk about it.
What kind of things do braces fix, and how do I know what I'm a candidate for?
Braces can fix a lot of different things. One of the things that braces fixes is crowding. That means if all of your teeth are kind of bunched up together, it doesn't take a rocket science to know if you don't like your teeth and they're all bunched up, that braces can fix it. Another thing that braces fixes, gaps in spaces. Gaps in spaces, you might have one gap between your two front teeth and you don't like it. You may not want to look like Madonna. Or you might have gaps everywhere. I find that a lot of people who have gaps also have a overbite. And an overbite just means that your teeth kind of stick out a little bit more further forward. And that's usually something you can appreciate more from the profile view than from the front. But if you don't like how far forward your teeth stick out, braces can also fix an overbite. Braces can fix an underbite. An underbite means your lower jaw is a little bit more forward, or your teeth are a little bit more forward. Now that's a little bit tricky depending on how far forward that is. Braces can fix that also. Braces can also fix an edge-to-edge bite. That means that when you bite down, your top teeth and your bottom teeth comes completely together. There is no kind of overlap. They're just right on each other. Another thing braces can fix is an open bite. An open bite means your back teeth come together and your front teeth do not touch. I always tease my patients when I meet a patient with an open bite, and I say to them, well, it must be hard for you to chew a sandwich, because a lot of patients, they'll complain that when they go to bite into something, they can't really actually bite into it. They have to put the food in the back because their back teeth are together, but their front teeth are open. Now, there are also open bites in the back, which get a little bit more complicated, and that means your front teeth come together and your back teeth are apart, or just general teeth that are kind of not coming together the right place. That sometimes can cause TMJ issues, with a lot of people are concerned about, which braces help to fix also. braces can also fix a crossbite. I know all of these terms sound very technical, and I can show you in other videos what that means, but that basically means that your top teeth should be outside of your bottom teeth. Your bottom jaw is tucked away inside of those. Now sometimes it's the opposite, that the outside jaw is larger and those bottom teeth are out further than the top. So it's a cross bite. So there's a lot of different things. Like I said, crowding, gaps in spaces, underbite, overbite, cross bite, open bite, all those things. You may not know what that means for you, but that's something we can discuss which kind of braces is more likely to help you with that situation.
If I get clear braces or Invisalign, do I have to wear them all the time? Can I eat and drink with them?
No, you cannot eat with clear braces. That doesn't mean you're not eating at all. You're just not eating with them on. So when you decide to get clear braces, Invisalign, ClearCorrect, when you're going to eat, you're going to take them off. And I always give you this nice little green container that I always say it goes into the container. And the reason it's so important for it to go into container, lots of people wrap it up in a napkin and toss it in the garbage, or maybe a family member is cleaning up, can't even see it, and swipes it away. So whether you're brushing your teeth at home, I usually give you 2 cases, one for to travel with, whether you're a man or woman, in your purse, wherever you keep it, and then one in the bathroom. So you take it off, you have a meal, enjoy your meal, and then when you're done, you brush your teeth or rinse your mouth depending on where you are, and you put it back on. And that just ensures that you don't lose it. But it's one of the convenient things about it, that you can take it off and have a meal.
If I get fast braces, what is the process like?
The process of the fast braces starts with a consultation. First, we have to figure out what your needs are. What are we trying to accomplish? What are we trying to fix? Gaps or spaces, overbites, crowded teeth, overlap teeth, whatever it is, we'll decide what it is. Once we've done that, then I take photographs and sometimes impressions of your mouth, so I can have some study models, something to see when you're not there. Because at that point, I'm creating a plan just for you. Once we've created the plan, we set an appointment. Once the brackets are ordered and delivered to our office, we set up an appointment so that you can come in and we actually start placing the brackets. For time's sake, some people choose to do that in 2 appointments. We do the uppers first and then the lowers, or sometimes we have a longer appointment and we bond and place those brackets onto your teeth at the same time. I have really great videos showing you exactly how that process goes. But we get them all onto your teeth, we engage wire, we will decide whether or not we need to do rubber bands or elastics that you'll wear at nighttime, and we'll give you all the directions for maintenance, a little wax if you have a sore spot. But that's the whole process of fast braces. After that, typically I will see you once a month, and on that monthly visit, depending on what's going on, I'll be working on moving a particular tooth or maybe rebonding a bracket that has come off, but that will be different for everyone's separate situation.
If I get clear braces, what is the process like?
Now the ClearCorrect process, or the clear braces or Invisalign process, is not much different from the fast braces, except that first visit again is a consultation. We talk about why you need braces, what you're trying to accomplish, what's the situation that's going to be best for you to fix it. And once we've done that, again, we're going to take photographs of your face and your mouth, and then we're also going to take molds. Now those molds are going to go to the company that's going to create those series of aligners. Now one really cool thing that we do with ClearCorrect is that we get a digital treatment plan, and it's really cool, and I'll show you in some other videos how we can show you gradually how every step, every 6 weeks I'll see you, and every step how you'll see how your teeth will change. And it's really cool to see from start to finish how your teeth will change over time, because most of the time people can't really see it. You see yourself every day, but kind of seeing that whole process on the computer is really cool, and I get to share that with you. Now another thing that we do is you'll also get a more accurate estimate as far as how long I think you're going to be with wearing ClearCorrect. So you actually have how many weeks we think it's going to take. Now of course at the end, if it's not exactly right on, it's usually a pretty right on estimate for the most part. So you'll get to kind of get more definitive. I usually, because I've done enough of these cases, I usually can say, you're going to be about 12 months, you're going to be about 18 months or 2 years or 6 months. I'm pretty close most of the time. But when you do that visit with the treatment plan, you get to see exactly how long they think from a computer, digital model on the computer, and I can walk you through the whole thing. It actually tells us exactly what we're going to do on each appointment, how long it's going to take for you.
How long will I have to wear the fast braces?
Most of my patients who get fast braces, I usually give them a pretty accurate estimate from the beginning as far as how long they're going to have to wear them. With fast braces, it's really that. It's fast. So compared to traditional braces, which I've heard stories of 2, 4, many years in braces, kind of wearing them a long time, it's not the case. If I thought that was the case, then most of the time I would tell you from the beginning, look, this is going to take a little longer. But my definition of a little longer is a lot different than an orthodontist's definition of a little longer. So as far as fast braces, most of our cases are completed within a year. Now, sometimes shorter, sometimes a little longer, but the average is about a year. And most people are very comfortable with that timeline. And again, I will see you every 4 weeks for a checkup visit, and depending on what's going on then is what we'll decide is what's necessary to do on that visit. I've seen cases done as short as 3 months and cases as long as 18 months, but the average is about a year. And most people, I would say the average is probably like 9 to 10 months, depending on what we feel like at the end, maybe some little things that we're doing at the end. But 9 months, a year, that's what you usually can expect depending on your situation.
How long will I have to wear the clear braces?
Now with ClearCorrect or Invisalign, I can usually give you a much more accurate estimation as far as how long you're going to have to wear them. For the most part, like I said before, you will go and you will have a digital treatment plan, and that digital treatment plan will give you down to the week how many weeks we'll need. Sometimes it'll say 38 weeks, 52 weeks, or 60 something weeks. It really just depends on your particular situation, but there's not a lot of mystery there. For the most part, after that visit that we took those pictures and we took impressions and we sent them off, once we get the digital treatment plan, you will be able to know what that is. And some people would like to know how long before they make a financial commitment, and I'm completely okay with that. We do free consultations where I can take those photographs, I can send them off, and then we'll get a more kind of generalized. It won't have the digital treatment plan with exactly how everything changes over time, but you will get a more accurate estimate if you have certain life events like a wedding, or you're going off to college, which I get a lot, or you're moving out of town and want to get that done before you leave, or you're running out of insurance. Whatever the case is, usually we can give you a pretty accurate estimate. And if you want a free consultation, it's just simple as photos. We take photographs and then we get a pretty accurate, hey, that's going to be about 18 months, that's going to be about a year, so that way you can know what the process is going to be like.
Is it going to hurt?
One of the things that Fast Braces, the company, boasts about is the fact that they say that they don't hurt as much as traditional braces. Now, I have found that to be true with my patients personally, because I always ask, how you doing? How's everything felt? For the most part, of course, in the beginning, you have brackets and wires on your teeth. You may feel some scratching on the inside of your cheeks and your lips. Within a month, most people completely forget about it. It feels like a part of them. We give you lots of wax to coat the area, but for the most part, like I said, you get used to it pretty quickly. Now, as far as we don't tighten fast braces like in traditional braces, how you have a visit where we're constantly changing the wire. I don't change the wire very often because it's just not necessary with that kind of treatment protocol. So most of the time, if you do have any teeth that are sensitive, those teeth are sensitive because they're very out of place and they're being moved more than the other teeth. And that's not usually a whole mouth, I can't eat and drink for a week kind of thing. I had a sister in braces for a long time, so I remember those days. But it's more of a, oh, that tooth is particularly sensitive. So I wouldn't say that they hurt as much as you might have a sensitive tooth or two, depending on which tooth is being moved.
If we get braces, do we have to get our fillings done first?
Absolutely. if you're getting braces, any kind of braces, whether it is Invisalign, ClearCorrect, fast braces, traditional braces, you want to have healthy gums and teeth. That means no cavities. And the reason that's so important is once we have those brackets and wires, or if we're in the middle of treatment with ClearCorrect, it makes it much more difficult to treat you with all that stuff around. Now, it can be done. However, it's much more difficult. But my requirement personally is that you're cavity free before we do any sort of braces, because we really want to ensure that we're focused on treating and correcting the misalignments in your teeth, and we're not really focused on, fixing fillings here and there. Now, again, if we see one, we're going to take care of it, but it's not our goal to be interested in that right now. So we want to make sure that we have all the cavities all done, that you had your teeth cleaned, that everything is in very tip-top shape before we start doing any sort of braces.
If we get braces, do we have to have our wisdom teeth out first?
Wisdom teeth before braces is one of those tricky things. It has a couple of different requirements as far as I'm concerned, and one of those is age. Now, if you are, for example, 18 years old, your wisdom teeth are still kind of under the gum. They look like they're going to peek through very soon. I am probably going to recommend that you have your wisdom teeth taken out before we start braces. And because we don't want those wisdom teeth disrupting the process. Wisdom teeth have a tendency to come in and crowd things up if you don't have space and kind of just disrupt things altogether. So we want to make sure you don't have wisdom teeth. Even if they're not bothering you and there's no pain in them, we want to think about whether or not that's necessary. Now, also, as far as wisdom teeth are concerned, let's say you're 35 years old and your wisdom teeth are completely straight. Probably not going to tell you to take your wisdom teeth out because they're completely straight, completely cavity free, which is very important, and they're not disrupting anything. So age is a big component. The second component is position. If the wisdom teeth are laying sideways and you're packing lots of food around them, that has nothing to do with braces. I'm probably going to tell you to take them out anyways, because that's a problem and an emergency waiting to happen. So if the wisdom teeth are sideways, they have cavities, we got to get rid of them. We don't need that disrupting the whole goal of getting your teeth straight. So we can talk about the different scenarios, how old you are, the position of your wisdom teeth, are they impacted, or are they way high up and they're never going to come down, so there's no need to worry about them. I take a lot of wisdom teeth out on a weekly basis, and for the most part I don't have a hard rule on there. I look at a lot of different factors to determine if I'm going to encourage you to have your wisdom teeth out, and especially if we're doing braces, I may push the timeline up sooner because I don't want wisdom teeth to disrupt anything that we're doing with braces.
Thank you, Dr. Denis.